Sexually transmitted diseases, everybody's favorite topic. So some general signs and symptoms, typically they're going to affect the genitalia, but they can affect other structures, especially like the oral cavities or things like other mucous membranes. And they also can have systemic effects instead of just localized in the genitalia. So general rule of thumb, we want to avoid contact with skin lesions and any kind of discharge. Remember, you can still transmit it to yourself, like if you touch it and then touch your eyeball or something. I don't know. Don't be weird. Just don't touch it. And then afterwards, even if you're pretty sure you didn't touch anything, make sure you wash your hands very well with warm soapy water after contact. Okay, some other, kind of signs and symptoms. You may have discharge, they may have painful urination or kind of a purulent discharge. It just depends on which one it is. So gonorrhea is a bacterial infection. It causes painful urination and a purulent urethral discharge in men, but oftentimes is asymptomatic in women. So that can be problematic. Untreated gonorrhea can actually lead to infection of other genitalia structures and is a leading cause of pelvic inflammatory disease in women. Untreated gonorrhea can also lead to septic arthritis. Now, your genital warts are going to be fleshy growths that are caused by a number of human papilloma viruses, or HPV. Now, there are certain strains of HPV that are associated with cervical cancer in women and cancers of the external genitalia, throat, things like that. There is a vaccine against the most commonly implicated HPV viruses and is recommended for girls and boys beginning about 11 or 12 years of age. Chlamydia is going to be an organism that has characteristics of bacteria but lives within the cells like a virus. It's a common STI that can affect the eyes and respiratory system, and it's spread through the transfer of infected secretions as well as sexual contact. It can cause blindness and pneumonia in babies who are born to infected mothers and is a cause of pelvic inflammatory disease. In the genitalia system, its signs and symptoms are similar to that of gonorrhea, but may or may not be symptomatic. Now for your syphilis, this is a bacterial infection that is transmitted sexually, but can also be transmitted through other contact with the lesions. Contact with the blood of an infected person, such as through a needle stick, can also result in disease transmission, but the risk is a little bit lower. Untreated infected women can pass this infection along to the fetus, which results in congenital syphilis. And syphilis infection is going to evolve through 4 stages if it is untreated. So for primary syphilis, it's about 3 to 6 weeks after exposure. You'll have a painless lesion called a canker that occurs at the site of exposure, and you may have some lymph nodes that are enlarged. Secondary syphilis is about 5 to 6 weeks after that canker heals. The patient may get a rash on the palms of their hands or the soles of their feet, or in like the warm, moist areas like the joints or something like that, like in the groin. And you may lose hair in the affected area. In the latent syphilis, the signs and symptoms disappear for a period of time. That could be months to even years, but at some point the secondary stage symptoms can reappear. And then about a third of the cases develop what's called tertiary syphilis, and what this is you get painful lesions on the skin and bones, and you get a cardiovascular infection which could lead to aortic aneurysms, and you can also have neurological signs and symptoms like neurosyphilis, which can actually lead to progressive dementia and even blindness. Now, your herpes simplex virus are going to be affected by affect your mucous membranes and your skin. An infection is going to result in blisters that ulcerate and cause those ulcers to pop up. Herpes type 1, simplex type 1, usually affects the oral mucosa, which is resulting in cold sores, and herpes simplex type 2 usually affects primarily the genitalia. You have your general signs and symptoms of infectious diseases, including fever and malaise, and these usually accompany your primary infection. And in both cases, the virus is going to remain dormant between outbreaks but never actually goes away. This virus is spread through direct contact, and the lesions may or may not be visible during that contagious period. If you have a woman with genital herpes, the delivery risk of infecting the baby is pretty high if they are newly infected. They haven't developed the protective antibodies. If they have an older infection that has antibodies against the virus, it may actually help protect the baby to a certain degree.